member for Oxford.
Well, thank you, Madam Speaker. It's always an honour to rise in the chamber to talk about such an important issue that we're seeing not only in my riding of Oxford, but across this country. After 9 years of this Liberal-NDP government, we are seeing a national drug opioid crisis across our country. We are losing, since 2015, we have lost 47,000 Canadians to opioid drug overdoses. Because of their radical drug policies, we have seen a 200% increase in drug overdoses. That is almost 22 a day. And these are not just numbers, Madam Speaker. They're our friends, our neighbors. They have names. They are part of our communities. And to see the radical government agenda that allows for drugs to be given to our community is quite sad. And in my own riding, a mother came up to me during the summer who had a young son who had a shoulder injury. And he was prescribed opioids for his pain management and for his injury. He got addicted. He lost his family. His kids have left him. And he has not received any help for treatment, despite his family asking for it. In my riding of Oxford, there are no detox facilities. There are no treatment facilities. So even if people want to get support and want to get treatment, it's not available to them. Because after 9 years of this Liberal-NDP government, their radical policies do not work. There is no safe way of doing dangerous drugs, Madam Speaker. It doesn't exist. And recently, we have seen the Liberals' best friend out in BC, the Premier, the NDP Premier, Eby, who has also finally realized that his drug experiments don't work, that we have to invest in treatment. We saw that in Alberta as well, where they've cut down on their overdoses by 50%. Treatment works. In Oxford, I have a good friend, Patrick McMahon. Many in our community know him. He's a great champion. But he was not always involved in the community like he is today. He was struggling with addictions. He had been down and out in our community. But he got the treatment he needed. And today, he owns multiple restaurants. He gives back to our community and is a productive member of our society. I want to reiterate, human life is sacred. Human life is valuable. We cannot give up on our fellow citizens when they're asking for help. We should not give up on our friends, our neighbors, when it comes to treatment. And that is why a common sense Conservative team will ban government-sponsored hard drugs. We will defund unsafe supply. We will go after the big pharmaceutical companies that are pushing these opioids that are affecting our citizens. And we will invest in treatment to bring our loved ones home drug-free. So my question to the government is, will they finally take the lead from their favorite premier out in BC, NDP Eby, and invest in treatment?
Well, the Parliamentary Secretary to the Minister of Crown Indigenous Services.
Mr. Speaker, Madam Speaker, our hearts go out to the families and friends who have lost their lives to the toxic drug and overdose crisis. No community has been left untouched by this tragic public health crisis. We all have a responsibility to do everything we can to help Canadians not look away. As part of an overall comprehensive approach, our government continues to support efforts to divert people who use drugs away from the criminal justice system and towards health and social services. This approach helps reduce immediate harms and helps create opportunities for people to find the way to supports, including treatment and recoveries, while keeping communities safe. Prevention is critical. Everyone making the courageous step to seek treatment should have access without delay. Enforcement has a key role to play in disrupting illegal organizations who prey on vulnerable people. I think everyone across this House would agree we need prevention, treatment, and enforcement as part of a comprehensive approach. Where we disagree is when it comes to harm reduction. Harm reduction keeps people alive. Yet, Conservatives want to remove an essential tool to address this crisis. People accessing harm reduction services are choosing to live another day. They are choosing to access health care and to be connected to the system. Like any service, these services need to be well-resourced and well-staffed to be successful. But removing services for ideological reasons is the trademark of the opposition. People struggling with addiction aren't criminals. They need health care, not jail. We changed the legislation and issued guidance to make sure that in case of simple possession, police, prosecutors must now consider referring the person to health and social services, issuing a warning or taking no further action. In this way, they can consider both public health and public safety. These amendments mean that individuals have the chance to get the help they need to address underlying issues rather than being criminalized for health care issue. This strategy encourages a public health approach while making sure that police have the discretion to move forward with criminal offenses when public safety risks arise. We will always work with provinces, territories, and Indigenous communities and all partners to provide them the support they need to deliver the services to their communities need most. The overdose crisis has no borders and doesn't care about jurisdiction. We all need to be partners at the table working together. Not sowing division and attacking people on the front lines of this crisis, but working to help Canadians. There is no one-size-fits-all solution to this crisis, and it requires a multifaceted response. We are working so that Canadians have access to a full range of prevention, harm reduction, treatment, and recovery services and supports they need when they need it. For example, Budget 2024 announced $150 million over 3 years to support municipalities and Indigenous communities to help provide rapid responses to emergent critical needs related to the overdose crisis. We remain committed to working with provinces, territories, law enforcement, people with lived experience, Indigenous leaders and communities, professionals and regulatory bodies, and healthcare providers to stop the needless harms and deaths of people in Canada. Thank you, Madam Speaker.
The member for Oxford.
Madam Speaker, they've had 9 years and all we hear is talk and no action. Here's from a quote from the Chief of London Police. Diverted safe supply is being resold into our communities. It's being trafficked into our communities and is being used as currency in exchange for fentanyl fueling the drug trade. They are funding organized crime, Madam Speaker. So my question is very simple to the government. Will they finally end their catch and release laws that let the criminals cause chaos on our streets and finally invest in treatment so we can bring our loved ones home drug-free?
Honourable Parliamentary Secretary.
Madam Speaker, we will continue to work with all provinces and territories and partners to address the unique needs and support both public health and safety. Law enforcement has been clear. They do not want to arrest people for personal drug possession, but rather they want the necessary tools to address the issues of public safety. They support a comprehensive public health approach to addressing substance use harms where they can divert someone away from the criminal justice system to available, accessible health and social services. Our government's approach to addressing this crisis is comprehensive and collaborative. The crisis is ever evolving, making it essential to try new, innovative actions to save more lives. These actions are monitored closely so adjustments can be made where needed based on the evidence. Thank you, Madam Speaker.